What if your kidneys were slowly failing right now, and you had absolutely no idea? No pain, no warning, no obvious symptoms. Yet every single day, silent damage could be occurring inside your body. The frightening reality is that nearly 90% of people with chronic kidney disease don't know they have it until significant damage has already been done. And by the time symptoms become impossible to ignore, much of the kidney function may already be gone forever. That's why today's video could be one of the most important health videos you'll watch this year. Because your kidneys don't usually scream for help. They whisper. They leave subtle clues in your breath, your skin, your nails, your sleep, your muscles, and even your energy levels. If you know how to recognize these signs early, you may be able to protect your kidney function before it's too late. And make sure you stay until the end because the final warning sign is one that many people dismiss as normal aging, yet it may be one of the strongest signals that your kidneys are in serious trouble. Before we begin, if you're committed to staying healthy, independent, and active after 50, take a moment to subscribe to the channel and turn on notifications. Every week, we bring you trusted health information designed specifically for older adults. And while you're watching, tell me in the comments, how old are you and what country are you watching from today? I always enjoy hearing from our wonderful community around the world. Now let's begin. Number 10. Your breath smells different. Most people think bad breath comes from the mouth. Poor brushing. Gum disease. Certain foods. But sometimes the problem starts much deeper inside the body. One of the essential jobs of your kidneys is filtering waste products from your bloodstream. Every day your body breaks down proteins and creates nitrogen-containing waste that must be removed efficiently. Healthy kidneys handle this process without difficulty. But when kidney function starts declining, these waste products begin accumulating in the bloodstream. Eventually, your lungs try to help remove some of them. And that's when your breath can begin to change. Some people describe the smell as ammonia. Others say it smells like urine, chemicals, or even rotten fish. Doctors refer to this as uremic failure. It can also be accompanied by a metallic taste in the mouth. Suddenly your favorite foods don't taste right. Coffee tastes strange. Meat tastes unpleasant. Even water may seem different. One of my patients, a retired teacher in her 70s, complained that every meal tasted metallic for months. She thought it was a dental problem. Her dentist couldn't find anything wrong. When further testing was performed, declining kidney function turned out to be the underlying cause. Now, to be clear, bad breath alone does not mean you have kidney disease. Many conditions can cause changes in breath odor. But if it appears alongside some of the other warning signs we're discussing today, it's something you shouldn't ignore. Number 9. You're waking up multiple times every night to urinate. How many times do you get up during the night to use the bathroom? Once may not be unusual. Twice can happen occasionally. But if you're waking 3, 4, or even 5 times every night, your kidneys may be trying to tell you something. Healthy kidneys concentrate urine efficiently. They carefully regulate how much water stays in the body and how much leaves through urine. But when kidney function begins declining, this concentration ability becomes impaired. Your urine becomes more diluted. Your bladder fills faster. And nighttime bathroom trips become more frequent. There's another reason this happens. Throughout the day, fluid can accumulate in your legs, ankles, and feet. When you lie down at night, gravity no longer keeps that fluid in your lower body. It returns to the bloodstream, and your kidneys attempt to remove it. The result is increased nighttime urination. Many people assume this is simply part of getting older. But sometimes it's one of the earliest signs that kidney function is beginning to decline. Of course, other conditions can also cause frequent urination, including diabetes, enlarged prostate, overactive bladder, sleep apnea, and heart disease. That's why proper testing is so important. Number 8. Your fingernails may be sending a warning signal. Most people never think of looking at their fingernails for signs of kidney disease. Yet doctors have recognized nail changes associated with kidney dysfunction for decades. One of the most classic findings is called Lindsay's nails, sometimes known as half-and-half nails. The lower portion of the nail appears reddish-brown while the upper portion appears pale or white. The nail seems divided into 2 distinct sections. Researchers still don't completely understand why this happens. Some believe it results from changes in blood flow within tiny nail bed vessels. Others suspect pigment accumulation plays a role. While these nail changes don't automatically mean kidney disease, they can serve as an important clue. In fact, some people notice these changes long before they experience other obvious symptoms. That's why paying attention to subtle changes in your body matters. Number 7. Dry, rough, itchy skin that doesn't improve. If you've noticed your skin becoming unusually dry despite using moisturizers, don't dismiss it too quickly. Healthy kidneys do far more than filter waste. They help regulate minerals, hormones, hydration, and numerous processes that affect skin health. When kidney function declines, the balance of calcium and phosphorus can become disrupted. Sweat glands may become less active. Natural skin moisture decreases. The result is skin that feels dry, rough, flaky, and irritated. Many people notice these changes on their legs, arms, back, and chest. But what makes this symptom especially frustrating is the itching. Some individuals describe it as an itch they simply cannot escape. They scratch one area only to feel itching somewhere else moments later. Sleep becomes difficult. Concentration suffers. Quality of life declines. This type of itching, often called uremic pruritus, can become severe as kidney disease progresses. And for some patients receiving dialysis, it becomes one of the most challenging symptoms they face. But here's the important part. Skin symptoms often appear before many people realize something is wrong internally. That's why listening to your body's signals is so important. Number 6. Darker skin patches appearing without explanation. Have you noticed darker areas developing on your face, neck, arms, or other parts of your body? While many people assume these changes are simply age spots or sun damage, sometimes the explanation lies deeper. When kidney function slows down, certain hormones can accumulate in the body. One of these hormones influences melanin production, the pigment responsible for skin color. As melanin levels increase, patches of darker skin may begin appearing. Some individuals notice gradual darkening around the neck. Others see changes on the cheeks, forehead, or forearms. Because these changes often occur slowly, many people fail to recognize them until comparing older photographs. Again, this symptom does not automatically indicate kidney disease. However, when combined with other warning signs, it deserves attention. And what comes next may surprise you even more because the next sign often appears before people ever suspect a kidney problem. Number 5. Strange bumps appearing on the skin. Some people with declining kidney function develop small raised bumps that seem to appear out of nowhere. These bumps often have a rough texture and may contain a hardened center. Doctors refer to this condition as acquired perforating dermatosis. While the name sounds complicated, the underlying process is surprisingly simple. When the kidneys can no longer efficiently remove certain waste products, inflammation increases throughout the body. The skin may attempt to push damaged material outward, creating these distinctive bumps. Some people notice them on their arms. Others develop them on their legs, back, or torso. They may be itchy, irritating, and persistent. Although other medical conditions can cause similar skin changes, including liver disease and thyroid disorders, unexplained skin lesions should always be evaluated by a healthcare professional. Number 4. Constant fatigue that doesn't improve with rest. This may be one of the most overlooked warning signs of kidney disease. If you're over 60, it's easy to assume fatigue is simply part of aging. But persistent exhaustion is never something that should be automatically dismissed. One of the critical jobs your kidneys perform is producing a hormone called erythropoietin. This hormone signals your bone marrow to create red blood cells. Red blood cells carry oxygen throughout your body. When kidney function declines, erythropoietin production decreases. Fewer red blood cells are produced. Oxygen delivery suffers. The result is anemia. And anemia can leave you feeling exhausted even after a full night's sleep. One of my patients, a 68-year-old grandfather, told me he stopped taking his daily walks because he felt tired all the time. He assumed he was simply getting older. But testing revealed moderate kidney disease and anemia. Once the underlying problem was identified and treated, his energy gradually improved. If you've recently noticed that everyday tasks seem harder than they used to, don't automatically blame age. Your body may be trying to tell you something important. Number 3. Muscle pain and nighttime cramps. Have you ever been awakened in the middle of the night by a sudden, painful leg cramp? If so, you know how intense these cramps can be. Healthy muscles rely on a delicate balance of minerals including calcium, potassium, sodium, and magnesium. Your kidneys play a major role in maintaining this balance. As kidney function declines, these mineral levels may begin drifting outside their ideal ranges. Initially, you may experience mild soreness after normal daily activities. Later, that soreness may progress into frequent cramps, especially in the calves, feet, or thighs. Many people notice the cramps becoming more severe at night. They wake suddenly from sleep with sharp pain that forces them out of bed. While muscle cramps can occur for many reasons, kidney dysfunction is often overlooked as a potential cause. And if these imbalances continue long enough, an even more serious problem can develop. Number 2. Gradual muscle loss and weakness. This warning sign often develops so slowly that many people don't notice it at first. Your clothes become slightly looser. Carrying groceries feels harder. Climbing stairs takes more effort. Standing up from a chair becomes increasingly difficult. Over time, muscle mass begins disappearing. Why does this happen? When kidneys lose function, acid can gradually accumulate in the bloodstream. To compensate, the body may begin breaking down muscle tissue. At the same time, inflammation rises. Hormonal imbalances develop. Vitamin D levels may decline. Protein metabolism becomes impaired. Together, these changes create the perfect environment for muscle wasting. This isn't simply a cosmetic issue. Muscle loss dramatically increases the risk of falls, fractures, hospitalization, disability, and loss of independence. For older adults, preserving muscle mass is one of the most important factors for maintaining quality of life. Which brings us to the number 1 warning sign. And this is the symptom that countless people mistakenly blame on aging every single day. Number 1. Feeling fine while silent damage continues. This may sound surprising, but one of the most dangerous signs of kidney disease is having no obvious symptoms at all. That's right. Many people with early kidney disease feel completely normal. No pain. No fatigue. No itching. No cramps. Nothing. Meanwhile, kidney damage continues quietly in the background. This silent progression is exactly why kidney disease has earned the nickname, the silent killer. In fact, many patients don't discover a problem until routine blood work reveals abnormal results or until significant kidney function has already been lost. That's why regular screening is absolutely essential, especially if you're over 60 or have risk factors such as high blood pressure, diabetes, obesity, heart disease, or a family history of kidney problems. Now here's something that could potentially make a huge difference. Most routine health screenings include a blood test called creatinine. Creatinine is useful and widely used, but it doesn't always detect kidney problems early enough. Creatinine levels can be influenced by muscle mass, age, gender, hydration status, and several other factors. In some cases, kidney function may already be declining while creatinine still appears relatively normal. This is why many kidney specialists increasingly recommend combining creatinine testing with another marker called cystatin C. Unlike creatinine, cystatin C is less affected by muscle mass and may detect subtle changes in kidney function earlier. Several studies suggest it can provide a more sensitive assessment of kidney health, particularly during the early stages of disease. If you're concerned about your kidney function, it may be worth discussing cystatin C testing with your healthcare provider. The earlier kidney disease is detected, the greater the opportunity to slow progression, address underlying causes, and preserve the kidney function you still have. Remember, your kidneys work around the clock every day of your life. They filter approximately 50 gallons of blood daily. They regulate fluid balance, control blood pressure, maintain electrolyte levels, support red blood cell production, strengthen bone health, and help keep nearly every organ system functioning properly. Yet most people don't think about their kidneys until something goes wrong. Don't wait for severe symptoms. Pay attention to the small clues. listen to your body, and take action early. Now I'm curious. Which of these warning signs surprised you the most? Was it the breath changes? The nighttime urination? The skin symptoms? The muscle cramps? Or the fact that kidney disease can remain completely silent for years? Let me know in the comments by typing the number of the symptom that surprised you most. I read as many comments as possible, and your answer may help someone else recognize a warning sign they've been ignoring. If you found this video valuable, please subscribe to the channel, give this video a thumbs up, and share it with a friend or family member over 50. You never know whose life this information could help protect. Thank you for watching, stay healthy, stay proactive, and I'll see you in the next video.